Hello, everyone, and welcome to Meet the Muscle Bleed, part of the National Hemophilia Foundation's Make Your Move Physical Therapy webinar series. This series is supported by a cooperative agreement from the Center for Disease Control and Prevention. Our speaker today is Grace Hernandez. Welcome, Grace. Grace Hernandez, PT, is a graduate of the University of Delaware Physical Therapy Program and has been working at the Hemophilia Treatment Center at the Children's Hospital of Orange County since 1993. She now works full-time for the HTC called the Center for Inherited Blood Disorders. Grace has participated in several research studies and was awarded the Physical Therapy Research Award from NHF in 2014 to look at gross motor delays in boys with hemophilia. She was the past chair of the Physical Therapy Working Group for NHF and continues to participate in the global hemophilia community, attending all national and international meetings. Grace is committed to developing patient care-related education, her local HTC, on a regional level. After the presentation, please click on the webpage link to fill out our evaluation form. Your valuable input will help us better define programs for the future. The PowerPoint presentation will be available as a handout in the future. For more information, please visit www.hemophilia.org or www.stepsforliving.hemophilia.org. Without further ado, I will turn things over to Grace.
Welcome, everybody. Today's webinar, we are going to focus on learning all about muscle bleeds, but mainly we're just going to focus on the muscles that are located in the arms and the legs. So for today's objectives, this webinar will recall the signs and symptoms of a muscle bleed, understand common causes of a muscle bleed, list some of the complications that can result from a muscle bleed, explain other ways that you can help the bleed resolve besides infusing factor, identify where muscle bleeds can occur in the arms and the legs, and learn what certain muscles do and how to modify your activity. So first, let's look at the signs of a muscle bleed. And so these are things that you may see, changes in your leg or your arm, or things you may feel during a bleed that's happening in a muscle. So the general signs of a muscle bleed: pain will usually be felt at rest, and also it will get worse when you stretch or you tighten the muscle. There'll be swelling over and around the area of the muscle. The skin over the muscle might feel warmer than skin on the other leg in the same location. There could be firmness, tense, or even a hard feeling to the muscle. Tender, so the muscle, the area over the muscle will be quite tender to just very gentle pressure over the muscle. You'll notice decreased strength. The muscle will feel weak, or you might not even be able to tighten it at all. You'll have limited motion in the joints above and below the muscle. And so what we're talking about is if you had a bleed, let's say in the front of your thigh muscle, your knee and your hip motion will be limited. So let's look at some of the common causes of a muscle bleed. It's been reported that about 10 to 25% of bleeds in people with hemophilia occur in the muscles, and most of these occur due to trauma. So here's a list of some common causes of muscle bleeds. We have overexertion, which is a way of saying that the muscle is getting tired, but you don't rest it. You keep using it for an activity even though it's getting fatigued, which leads it to getting an injury. The muscle can also get overexertion from using it over and over again for the same activity. Muscles also can get and bleed from overexertion if you're not using it properly due to poor training or poor body mechanics. Another way a muscle can get a bleed is from overstretching it. So this would be when your muscle has a certain flexibility capacity to it and you stretch it beyond its limit, pulling and tearing the fibers, which will cause a bleed. You can also get one from a direct injury if you think of falling, a sudden twisting motion, or impact of a hard object like a ball, racket, bat, something comes in and hits your arm or your leg during a sport or other physical activity. You can also get a muscle bleed from intramuscular injections, which we would see when a child gets vaccine shots. They typically do them into the muscle. However, people with bleeding disorders, it's usually recommended that they get them under the skin. But we do still see patients getting intramuscular injections, which can cause a bleed. So some complications of muscle bleeds. What might happen, and this really depends on the location and the size of the muscle bleed. So general complications, these are the ones usually the physical therapist is looking at when you come into the clinic. If you have loss of range of motion, so that means how much your joints move, and this limit how much your joints will move from the muscle having a bleed because it gets tight, it won't stretch, and so this is going to restrict the motion. The muscle can also get very weak from you not using it and also from the direct injury, and so you'll lose strength, and this will impair your functional activities. You can develop permanent muscle scarring because as the muscle fibers repair themselves, they do so with some scar tissue and repair the fibers. But if this scar tissue doesn't get reabsorbed, the muscle can get restricted and you'll lose flexibility. You can also get peripheral nerve damage, which we're talking about the nerves that are away from your body, the ones that run down your arms and legs. So if any of these nerves happen to be located near the swelling, the blood, hematoma, they can get compressed and you can lose feeling or use of your muscles that those nerves innervate. You can also get tendon damage. So the tendon is where the muscle attaches to the bone. So you can also get injury to that part of the muscle besides just the muscle tissues itself. Now we're going to talk about some more serious complications that can happen with muscle bleeds. And these are ones that are more medical in relation, and so it would require a little more medical intervention than the physical therapist would be involved at these points. So a muscle bleed can cause an excessive amount of blood loss because a muscle can hold a large amount of blood, and sometimes it'll be bleeding for a long time before you actually notice symptoms. You can also get an infection, so the hematoma or the blood clot can actually become infected. You can get myositis ossificans, which is when the muscle tissue is trying to repair itself. You can actually get bone formation in the muscle tissue, especially after an impact injury, and so that bone doesn't allow the muscle to stretch and flex and can also set up a point in the muscle belly where it can get torn and cause more injury. There's pseudotumors can happen, and that's something that is seen in some patients with hemophilia. And what happens is the blood clot, the hematoma, actually forms a tissue barrier around the hematoma, kind of protecting it. So your body can't break the blood clot down with its enzymes, and the factor can't get to it. So the hematoma actually starts to grow and get bigger and can cause damage to the surrounding tissues and bones. The other serious complication that can occur is a compartment syndrome. So we see this when certain muscle groups and nerves and blood vessels kind of run in the same little compartment, and they're wrapped with non-stretchy tissue called fascia. So as the muscle starts to bleed and get bigger, it actually causes pressure on the nerves and blood vessels that are wrapped in this non-stretchy tissue that are close to it, and then that can cause damage to the blood vessels and the nerves. And these are some signs of a compartment syndrome. And so these are very important for you to be aware of because an acute compartment, I'm going to pause there. An acute compartment syndrome is in a medical emergency. So let's go over these in detail. So if you have intense, severe pain that seems out of proportion to what is typically expected when you have a bleed, that might be a sign that you're having a compartment syndrome. If the muscle feels very full, very tight and tense, you might be having a compartment syndrome. The other things is if the skin is really tight and taut or even shiny, it gets like that because there's so much swelling happening underneath. If you have tingling or burning sensations in the skin, that's a sign that the nerve is getting compressed and irritated. Especially if you have numbness or you lose feeling in a certain area of your arm and leg, that's a sure sign that the nerve is getting compressed and it can't relay or retrieve signals below where the nerve's getting compressed. You can also lose the ability to tighten and move a muscle and get paralysis. So all of these symptoms are very important to be aware of so that you can get intervention as soon as possible. This is a photo of a gentleman who ended up having compartment syndromes in his forearm muscles. And what actually has to happen when you get a severe acute compartment syndrome, they have to go in surgically and cut the fascia and tissue to open up that compartment to relieve the pressure from the nerves and the blood vessels. So you can see here on his forearm and the back of his arm where they had to cut into the skin and relieve the fascia compression. And these are the scars that were left from that surgery. So we're going to talk about some physical therapy treatments for muscle bleeds. So this is what you can do besides factor infusions to help the bleed resolve. In the acute stage, when the muscle is actively bleeding, the goal at this stage obviously is to stop the bleeding, relieve the pain, and prevent further injury. So we always think about factor fast. You want to get that factor in as soon as possible because waiting to infuse will allow the more bleeding to occur, and more bleeding means more complications, and the more blood that accumulates means a much longer recovery. So we talk about this PRICE, and that is really just first aid treatments for bleeds and injuries. And the PRICE stands for protection, rest, ice, compression, and elevation. And I did note that during the acute stage, compression is not appropriate because as we talked about the compartment syndromes with the nerves getting compressed and irritated and the blood vessels from the swelling going along in the muscles next to them, you don't want to then apply pressure from the outside and cause any, I'm going to pause there. Okay, and cause any further damage to the nerves at this stage of the bleed recovery. So protection, we want to avoid further injury and more bleeding. So we really recommend that you limit the movement of whichever part of your body is having the muscle bleed, whether it's the arm or the leg. So especially with an arm, you're going to want to use an arm sling or some other kind of brace to support the muscle and limit movement. You can use a splint or some other kind of support for your leg if you're having a bleed in your leg. You also want to limit weight bearing. So you're going to use assistive devices as crutches, a walker, or even a wheelchair so that you're not putting any weight on that leg. If you do not have any of these items or don't know how to use any of these items, if you have them at home, please contact your hemophilia treatment center so you can get recommendations. And then resting. This is really to help stop bleeding, manage pain, and limit swelling. So we really want you to stop using that involved arm or leg for at least 24 to 48 hours and use the other arm or leg for all your daily activities. It may be necessary to restrict activity for several days longer depending on the location and the severity of the bleed. So ice or a cold pack is to help reduce the pain. So you can use a small bag of ice or a cold pack to the affected area as needed. Usually you are only going to apply this for about 15 to 20 minutes maximum every 2 to 4 hours. And you can use it for up to 48 hours or longer for more severe bleeds. You're always going to want to wrap a paper towel or a thin cloth around the ice bag or cold pack to avoid direct contact with the skin because it can cause skin irritation. And the elevation part is to help reduce and resolve swelling. So you're going to want to keep the injured leg or arm elevated as much as possible. So when you're at home, you're going to want to be on the couch or the bed somewhere, a chair, but you're going to want to have your leg propped up on pillows or your arm. And it's typically recommended, especially in the first 24 to 48 hours. Ideally, you're going to want to elevate the arm or leg above the level of your heart. And you can continue to use elevation as the bleed resolves if it's helping reduce the swelling in your discomfort. So in the subacute stage, this is where the active bleeding has stopped and your pain might have decreased a little bit. So the goal at this point is to prevent any rebleeding by starting activity too soon, and also to restore the muscle function. So at this point, we're going to recommend you only move the leg or the arm in a pain-free range of motion. Do not stretch the muscle because healing really hasn't started yet. You've just stopped the active bleeding. You're going to continue with PRICE. Now, depending on how severe your bleed was, or if you did or did not have any of those symptoms of the nerve being compressed, it may be okay at this stage to use compression. And we'll talk about that in the next slide. So the physical therapist at this point is going to teach you the exercises that would be appropriate for you depending on the severity of your bleed. They're going to monitor your increase in activity. They can provide splints, braces, taping, or assistive device training. And I just want to note that muscle bleeds are quite complicated to manage and treat, so I really recommend that you get guidance from the medical team at the Hemophilia Treatment Center when you have a muscle bleed, because they're not as simple as joint bleeds that you might be comfortable with treating on your own at home. So when we talk about compression, to reduce swelling and to help stop the bleeding, you can use an elastic bandage to give a little compression. So you're always going to want to start wrapping below the area of swelling, and you should use an X-cross pattern, not circular layers, to help push the swelling back up out of the area of the bleed. The bandage should be snug, but it should be loose enough to easily slide a finger underneath it. And then I note here again, do not use an elastic bandage if you have numbness, tingling, severe pain, or your skin feels cool around or below the bleed. Because again, these are kind of signs that you might be having some compartment syndrome. So you're obviously going to call the medical provider if you have any of these symptoms. This next slide just shows a young man who had a lower thigh bleed that I have actually put kinesiology tape on. You can see that light tan colored taping here. And I've put this on to help get rid of the swelling. And then we've wrapped it with an ACE bandage or an elastic bandage just in the area. He's really just swollen down here, not all the way up in his thigh. And as you can see, I started here and you can see how it like crisscrosses as opposed to going around in circular motions for his swelling. In the recovery stage, so now your symptoms are pretty stable. So the physical therapy goals at this point would be, again, prevent rebleeding, because muscle bleeds can rebleed quite easily. We want to regain your normal muscle function and prevent any permanent complications. So I really recommend, especially with a muscle bleed, to get a physical therapy guided recovery program, because they can help promote normal muscle healing and recovery, monitor and restore your range of motion and strength. They will slowly progress your exercise program to prevent rebleeding. They will give you appropriate increases in your daily activity depending on how your muscle is recovering. And they can also work with you to regain ability to return to your sport or physical activity. It might still be warranted to use the price first aid treatments if your muscle recovery is pretty slow. So let's talk about some of the locations that are typical to see muscle bleeds in people with hemophilia, and we'll talk about why you get muscle bleeds there. So this is just a list of the most common sites for muscle bleeds in people with hemophilia. The lliopsoas is the most common, the quadriceps, which is the front of the thigh, and the Gastrocnemius and Soleus, which is the back of the calf muscle, they're the second most common. And then if you look at your hamstrings, which are the back of your thigh, and then your gluteals or your muscles of your buttocks. With the arm muscles, you have your biceps and triceps, and then your forearm flexors and extensors. And we will now go into more detail about where they're located and what they do. And here's just a general representation of where these muscles are located. So we talked about the lliopsoas here. If you follow the arrow, you can see it's actually located really deep in your abdominal cavity. So it's not on the edge, on the outside, it's actually in between your back and the front of your hip. So it's really deep inside. As far as your quadriceps, you can see these are the muscles on the front of your thigh. The hamstrings would be these big bulky muscles on the back of your thigh. The calf, which are the gastrocnemius and the soleus, are located here. You have your gluteals for your buttocks muscles. And then your triceps would be the muscles on the back of your arm. Your biceps are your big bulky muscles on the front of your upper arm. The extensors of your forearm are the ones located on the side of your forearm where the back of your hand is. And the flexors are on the same side as your palm. So muscle function and how to modify your activity during a bleed. So we're going to look at very specific muscles, talk about what they do, and then how you can modify your activity to avoid causing a rebleed or damaging the muscle while it's trying to heal from a bleed. First, we're going to talk about the iliopsoas, and this is kind of a combination term for the psoas major muscle, which is this one, and the iliacus, which is this muscle. So they kind of put them together, calling the iliopsoas bleed. But you can actually have bleeding in one or the other or both. It is located, as you can see, the psoas starts up on the lower part of your spine, and the iliacus is on the inner side of your pelvis. And they both track down in your abdominal cavity and attach here on your upper thigh bone. And as I said, it's very deep in your abdomen, so you can't see it. And it's also very difficult for even a physical therapist to palpate these muscles. What these muscles do is they bend, or as we say, flex your hip, which is lifting your leg. So if you were sitting down in a chair, it would be raising your knee up in the air, or if you were lying down, it would be lifting your whole leg up off the surface. It also works to bend your body forward in sitting or standing. So if you're sitting and you would bend down to reach your toes to fix your shoes or something, or if you were lying down on the floor, it also helps pull your body up when you're doing a sit-up. It works to stabilize your spine and pelvis and your hip joints in sitting and walking. So it also acts as a good stabilizer for your lower lumbar spine. So think about it, it is working a lot when we're doing different walking, running, and different type of activities. And also really comes into play if you're sitting, and when you lean backwards, it really contracts hard to keep you from falling over backwards. So when we think about all these things that your psoas and your iliacus muscles do, there's a lot of things you really need to avoid when you're having the early bleed stages. So because it is a flexor of the hip, when it bleeds, it shortens up. So it's going to make you want to stand with your leg bent. So your hip's going to want to bend, because if you lie down with your leg unsupported, so you're trying to lay flat on your bed, that's going to really stretch the muscle when it's bleeding. So we don't want you to do that because it can cause more damage. So you're going to want to lie down with your legs supported on pillows. You don't want to lift your leg up when you're sitting down or lying down, because that's going to activate the muscle. You don't want to do any kind of sit-up motion. So if you're lying down in your bed, you do not want to sit straight up to get out of bed. Or if you're lying down on the couch, you don't want to sit straight up. You don't want to bend forwards to reach towards the floor when you're sitting or standing. You don't even want to kind of lean forward. If you're sitting on a chair, you go reach way forward to your computer or something else, that's going to activate the muscle also. And then we don't want you to try to stand upright really straight. We actually, when you're having a bleed, it's better for you to stand kind of flexed over a little bit, because it won't put any stretch on the muscle. We don't want you to sit without support. So if you're sitting at the edge of your bed or a chair, you kind of want to lean forward and use your hands to support yourself. And then you don't want to walk without support. At this time, the muscle really needs some help for walking, so we recommend that you use crutches or an assistive device. So we're going to go over some modifications for psoas bleed. So getting in and out of bed. As I said, we don't recommend that you do a straight sit-up type of motion. So you're going to run a roll on your side towards the bleed side or the other side, whichever one is tolerated. You're going to keep your legs together. So as you roll on your side, one leg will be on top of the other. And then you're slowly going to slide your ankles off the edge of the bed. At the same time, you're going to push up on the bed with both of your arms until you're sitting upright. This will prevent you from pulling your body up with that muscle as you're trying to sit up. And as I said, if you're sitting without like a support from a chair back, you don't want to lean back, and you actually want to use your hands to kind of help support you so that that muscle is not activating, constantly trying to hold you up. In standing, we actually want you to keep your foot on the floor when you're standing. Not really shifting your weight over on that leg, but at least to keep your foot on the floor, because if you walk with your leg elevated off the floor, that's what that muscle does. It lifts your leg up, so you're constantly contracting a muscle that's bleeding. So you're going to use crutches, a walker to support your body weight. If it's really serious, you might even just use a wheelchair because it's too painful to be up and walking. We don't want you to stand on the leg, and then, as I said, don't hold your leg up in the air. So it's called foot flat weight bearing. So you have your foot on the floor, but you don't actually shift your weight on it when you're walking. So you're going to use the crutches or walker to hold your body weight up. Your walking distance during active bleeding should be very limited, and your physical therapist should give you limits on how much to walk. And it's also recommended you take really small steps so that you don't stretch your hip. We're going to move on to the hamstring muscle, which are the muscles in your thigh that are located on the back. You have 3 big hamstrings here. 1 is located on the outside and 2 on the inside here. And this is just showing a picture of a tear injury to a hamstring muscle. The hamstring muscles, as you can see, start at the lower part of the pelvis, and then they run down and actually attach below the knee joint. So as I said, sometimes your range of motion is going to be limited at the hip and the knee because the muscle is stretched over both joints. The actions that the hamstring does is it bends or flexes your knee, like running, or if you think about lifting your foot up off the floor like you're trying to kick yourself in the bottom. It also moves the hip backwards. So hip extension, like in running and walking, it helps move your leg behind you. It also slows down running motion. So if you're running really fast and then you're trying to slow down, it helps at what we call decelerate the speed. It stabilizes your hips and pelvis. So when you're sitting and you bend forward to reach your toes and fix your shoe and then you sit back up, your hamstring muscle is contracting to keep you stable. Same thing when you're standing and you bend down to the floor and stand back up, your hamstring muscles are stretching and then contracting to help bring you back up to a standing position. So motions to avoid during a bleed in the hamstring. You don't want to try to forcefully or stretch out and straighten your knee because this will stretch the hamstring. So when you have a hamstring bleed, it's going to be more comfortable to have your knee in a bent position. You don't really want to forcefully bend your knee because that will make the muscle contract. So you can just have it in a comfortable resting bent position. You want to try to avoid reaching forward to your feet while you're sitting or bending over, reaching down towards the floor or your legs when you're standing. And you don't really want to stand with weight on both legs. If you're standing up, you're going to kind of want to shift your weight over to the leg that doesn't have the bleed. And we're going to talk about the quadriceps muscle, which are 4 muscles located on the front of your thigh. As you can see, there's this long rectus femoris, which actually starts up in your hip, and they all come down and connect to this one big tendon that goes across your kneecap and attaches to the front of your shin. There's 4 of them. There's one on the outside, inside, and then there's the vastus intermedialis, which is actually under, as you can see here, along the bone. It lies underneath the rectus femoris. And this one's an important one to look at, and we'll talk about that a little later in the presentation. So as I said, they start in the hip or the upper thigh bone, and they attach below the knee. They stabilize your knee when you're standing or walking, so they contract to keep it straight so it doesn't bend or buckle to prevent you from falling. It's a very powerful muscle for kicking and running. It also controls and slows down your knee motion. So when you're sitting in a chair or you're squatting or you're going down the stairs, it really controls how much your knee bends and not let it bend too quickly, causing you to fall. These are some images of patients that I have that have had knee contusions playing soccer, and they both developed thigh bleeds. This one you can see here is really located mostly in this lower part of his thigh on the outside. And this one here has more global swelling of his whole lower thigh, and you can't see the kneecap at all. And you can see quite a difference between this leg and this leg. And the reason I have, he trimmed his hair here so that I could put that kinesiology tape on him. And so this way you can see how perfectly visible the kneecap is and the contours of the muscle and the joint line, and it's completely lost on this side. So motions to avoid during the early stages of bleeding into the quadriceps or thigh muscles in the front would be, obviously you don't want to bend your knee because that's going to stretch your quadriceps. Every time you bend your knee, you're pulling and stretching those muscles across your hip and your knee joint. You don't want to stand on it because we talked about that muscle works to control the knee and stabilize it in standing and walking. Climbing the stairs, you're really going to use the muscle going up and down the stairs. Using the leg to sit down or stand up, so we'll talk about that later, how to not use that leg when you change positions. And then obviously you're not going to want to do any kicking motions with that leg. We're going to talk about the muscles, the Gastrocnemius and the Soleus muscles in the back of your calf. So in this picture, you'll see the 2 heads of the Gastrocnemius muscle here, and they're kind of your bulky calf muscles you're going to see from the outside. And here is the soleus, which actually lies underneath these 2 big bulky muscles, bellies. but they all kind of blend down here together and become the Achilles tendon. So the gastroc muscles start above the knee joint on the thigh bone. The soleus kind of starts at the back of the shin bone, and they all kind of come down here and attach to the heel. So what this muscle does is it points your foot down. It raises your body up when you stand up on your toes. It will propel your body forward like when you're running, jumping, hopping, even walking, and it also helps keep your knee straight because if it pulls, it's going to pull your knee backwards to help keep it straight. So this is another picture of a young child who had a calf bleed, and you can see the difference here in this one where obviously you have no discoloration. You can see the contour of the calf muscle and the ankle, and the knee joint still looks very visible. You can see the kneecap very easily right here. On this side, however, you can see all the discoloration from all the bruising coming to the surface. You can see how swollen his whole calf is. We've kind of lost this little nice lip contour here, and his knee joint is not visible because he's having so much swelling in his whole lower leg and calf from the bleed. So motions to avoid during early bleed stages in the calf muscles would be obviously pulling your foot and toes in an upward motion because this is going to stretch all the muscles in the back of your leg. You don't want to forcefully point your foot down. You don't want to stand on it or walk on it because standing is going to put a stretch on the muscle, and then that muscle also works quite strongly when you're walking and doing other activities, and we really want it to rest at this time. The other muscle I'm just going to touch on here is not one that's quite commonly injured or bleed seen in the hemophilia clinic, except mainly a lot of times when the kids are young because they'll fall on their bottom onto hard toys or other things in the home, and they might end up with a buttock hematoma. So we're just going to go over this briefly here, which is your gluteus muscles are kind of here on the back of your hips, and they start up here on your pelvis and attach on the outside of your thigh bone here. What they do is they help move your leg backwards when you're walking. They also help pull your body upright. So if you're bent over reaching to the floor, kind of how we talked about your hamstrings, as you stand back up, your gluteal muscles in your hamstring will help pull your body back to an upright position. It also, along with your thigh muscles in the front, controls your hip joint when you sit, stand, and when you bend forward and squat down to the floor. So motions to avoid in the early bleeding stages, again, are bringing your knee up towards your body. So if you're sitting down or standing and you try to pull your knee up towards your stomach, that's going to stretch the muscle. You don't want to do a lot of moving your leg behind you because that's going to activate the muscle. You don't want to lean forward too far when you're sitting or standing. Again, it will stretch the muscle and make it work. You don't want to sit. If you have a muscle bleed in this area, it will be uncomfortable to sit on it. So when you're sitting on a chair, you're going to want to sit with your weight shifted to the other side. And then standing and walking is going to activate the muscle, especially with stair climbing. So that's where we get into using an assistive device so that that muscle can rest and you can still be mobile up and walking about using the non-injured leg. So this is just going to talk about activity modifications for all of these lower extremity bleeds because they're all quite similar and there's not really that specific differences, just a little bit I will touch on at the bottom of the screen when we're talking about stairs and some of the walking restrictions. So when you sit down or stand up from a chair, what is recommended that you use both, if you have a leg bleed, obviously you're going to use both your arms and the other leg to stand up and sit down. So if you're standing up, you're going to shift your weight mostly to the non-injured leg, put the leg that has the bleed slightly out in front of you, and then you're going to reach back with your hands to help you lower yourself down to sitting. And then the opposite, when you're getting up off the chair, you're going to lean to the non-injured leg and push yourself up with your hands to standing. And then use your crutches, walker, whatever you're using to walk around to take the pressure off your leg once you're standing up. So we don't want you walking on that leg. So with your hamstrings, because if you had your foot bent behind you, keeping it up off the floor when you're walking, you're going to be constantly contracting that muscle. We would recommend that you would just let your foot or part of your foot rest gently on the floor so that muscle doesn't have to constantly contract when you're walking. The quadriceps muscle, depending on how tight it is, it might also be okay for you to just leave your foot in contact with the floor, but you have to be very careful not to actually shift your weight onto that leg because it will activate the quadricep muscle for it to start working with walking. So you have to be really careful in that stage and in that area. And then your gastroc soleus, you really want to keep your foot off the floor because any contact with the floor when you're having a bleed in that area, usually your foot is pointed down to relax, not stretch the muscle at all. So anytime you put pressure or try to stretch your foot, it's going to cause some overstretching to that area while the bleed's occurring. And with the stairs, you really don't want to put any pressure on the leg with the bleed. So you either have to use crutches or both your handrails for total support. And when you're going up, you're going to lead with the non-injured leg first. And then when you go down, you're going to use the rails or the crutches for total support, but you lead with the injured leg and then lower yourself down slowly, but not putting any weight on that leg. So we're going to get into the arm bleeds, and we're going to start with the tricep muscle. And this picture actually shows your triceps and your biceps. So your triceps are in the back of your arm here, and these are your bulky biceps in the front. And as you can see, they start in the upper part of your upper arm and your shoulder blade muscle, and then they attach down here below your elbow joint. So your tricep muscles straighten your elbow, and they also help move your arm behind you. So if you're reaching backwards behind you at your shoulder, that's your tricep muscles help pull your shoulder backwards. And you can see in this picture that as you bend your elbow, the tricep muscle gets longer and stretched, and as you straighten your elbow, it gets a little shortened and more relaxed. So here's a picture of a young patient that actually hit this part of his arm on the edge of a glass table. And he did factor right away and stayed on factor for quite a while for this bleed, but you can see all the bruising and discoloration, and you can see the big lump here on his arm. And this was taken maybe a week or two after the injury happened, but you can see how there's still a big you can see the bruising here, but on this slide you can actually still see the big lump here that he had from the original bleed. But look at all this discoloration and bruising is going all the way down his arm to his hand. And so that's what can happen when the bleed starts to break up and all that bruising comes to the surface. It can look quite extensive, even though it started out like this with hardly any bruising or anything down in his lower arm. So motions to avoid with the triceps, you don't want to bend the elbow because it stretches the muscle. You don't want to reach over your head or stretch your arm out in front of you because that also stretches the muscle. And that muscle does reaching and pushing motions. You know, it's really active when you do push-up type of activities, so you want to avoid those kind of activities. You're going to want to use your other arm for everyday activities, and you're only going to bend that elbow to a pain-free range of motion. Now, when we talk about the bicep muscle, I'm also going to talk about this brachialis muscle, which is another elbow flexor, but it's located under the bicep muscle, but you can't really see it from the outside. So these muscles are located in the front of the upper arm. The biceps you can see starts up here in the shoulder, above the shoulder, and then they all come and connect below the elbow. The brachialis muscle kind of starts in the upper part of the upper arm bone. So they bend the elbow. They also help raise your arm over your head, flexing your shoulder. And these are powerful muscles for carrying, lifting, and pulling objects. So motions to avoid with this muscle bleed are straightening the elbow because it's going to stretch the muscle. You don't want to reach your arm behind you because that also stretches the muscle. And then you want to avoid lifting, carrying, pulling, those kind of motions with that arm that has a bleed. So you're going to use the other arm for everyday activities. This bleed, it would be recommended that you use an arm sling, your jacket or pants front pocket to keep your elbow bent and let the muscles rest. Because if you're walking around with your arm unsupported in a bent position, those muscles aren't really resting. They're constantly contracting to keep your elbow bent. So you want to make sure it's supported and the muscles can have some rest. With your tricep muscle, it's kind of uncomfortable to be in an arm sling because now you're stretching the muscle. So patients usually are quite comfortable with their arm just hanging down by their side and don't need any kind of support for those type of bleeds. The forearm flexor muscles are located on the underside front of your lower arm. So this would be your palm side of your arm. They start inside in your upper arm above the elbow here. There's quite a lot of them. I'm not going to go into detail over all of them. We're just going to group them all together for this talk. And then they attach, you can see all these tendons coming down off the muscle, and they work all your finger and wrist motions. So they're going to bend your wrist, bringing your palm towards your body, and they're also going to flex your fingers to grip, pinch, or make a fist. And then we have your forearm extensor muscles, which again, lots and lots of different muscles on the back of your arm. You can see all the tendons coming down here to connect to the back of all your fingers. So again, they start above the elbow, and they're located on the outside of your arm, and they go down and attach to your wrist or down all the way to your fingers. So these muscles act to pull your wrist up and your palm away from you, and they also straighten and extend your fingers, like if you were going to point or let go of an object or lift your fingers up. Those are the muscles that are going to be working when you do those activities. So I kind of lump together the motions to avoid with both the flexors and the extensors, because they actually both kind of work when you're gripping, holding, and reaching for objects. So you're just going to kind of want to avoid that depending, doesn't matter which side of the arm that you have the bleed on. With the flexor muscles, you're going to avoid pulling your wrist back, straightening your fingers, straightening your elbow out, because this really stretches all those muscles. And with the extensors, you're going to avoid the opposite. You don't want to pull your wrist towards you, make a fist, and especially when your elbow is straight, that's going to stretch all those muscles. So as we said before, with an arm bleed, use your other hand, other arm for your everyday activities. Avoid using that hand for any gripping or carrying. You can use an arm sling for these type of bleeds, or even a wrist support to help rest the muscles. And whether it's on the front or the back side of the lower arm, we recommend that you avoid using any electronic devices with that injured arm. That means video games, your mobile devices, your phone, your computer, because typing and using your thumb actually activates the flexors and the extensors repetitively, so there's no real way to rest one group versus the other when you're doing these type of activities. So in summary, the big take-home message that I would like you to remember from this talk is really, really remembering the signs and symptoms of a muscle bleed, so that you can be aware if you overstrain it, playing a sport, any kind of physical activity, you get hit, if you fall down on something or you overstretch it, you're really going to look and see if you have these type of symptoms and be like, uh-oh, I think I have a bleed. I better call the center or get my factor in as fast as possible. So really look for swelling in the area, pain and tenderness. The muscle feels tense or firm. You've lost some strength in that muscle, and then you notice that you can't move the joints above and below where the muscle is hurting. The causes, remember, you can overuse the muscle, overexert it. You can overstretch it. It can get a bleed from a direct impact, and then also from injections. The medical complications, I just want to go over those again, that can occur during a muscle bleed that you really need to be conscientious about and seek intervention immediately. If it's a significant amount of blood loss, if you feel like you're getting nerve damage, numbness, tingling, loss of ability to use the muscle, the compartment syndrome symptoms that we talked about, an infection. So if you have a muscle bleed and you start getting a fever, or it's getting hot and red and getting more painful, it might mean a sign that it's infected in that area. And then the pseudotumor. So the muscle's not getting smaller with the factor. It's actually, you're noticing the swelling's getting bigger over weeks and months. It's not going away. So the muscle bleed locations, getting the actions in the arms, we listed them, but really just remember that these muscles really work to stabilize your body and move your extremities. So the big thing to do when you have a bleed in those areas is to follow the Price recommendations to help it resolve. Besides taking your factor, you're going to protect it, rest it, ice it, compress it, and elevate it. And remember, the compression, do not do it in the early active bleeding stages or even the subacute stages if you have any of those nerve signs that we talked about earlier. And then the big thing I want you to remember for activity modifications is don't stretch it and don't use it in the early stages of bleeding. And here are so many references that I use to prepare this presentation. And I just want to thank everybody for taking the time to listen to this webinar, and to please fill out the evaluation link on the web page.
Great, thank you very much. And ladies and gentlemen, your feedback is critical to us, not only in evaluating this presentation, but also when planning future webinars and programming. please complete a 2-minute evaluation survey on the website. Thank you for attending. This concludes the program.